Okay, we're doing a limited echo called Pocus. We're just doing point of care ultrasound, and we're just going to walk you through how to do the very basic views. First view that Tina's doing right now is a parasternal long axis. She's on top of the chest. The ideal position for the patient would be a left lateral decubitus with the arm up. In the situation you may find with a ventilator, the patient's going to be flat on their back. So you just get the best view that you can. You want the little button of the transducer pointing to the patient's right shoulder. And that's going to line you up pretty good for the parasternal long. And you can see here, where we got it on the chest. You kind of go between the ribs. And that's what Tina's doing now. And the first view we're looking for, we have a little bit of an increased depth to look for any pericardial effusion under, behind the heart. So there you go. Then you drop your depth. We're looking at the LV in a long axis. We're checking for function. We're checking for, we check for effusion, we're checking for function. We're checking for wall motion abnormalities. We're checking for the right ventricle size, function. We're also looking at the left atrial size, looking at the aorta. If we can go up a rib space and look at the ascending aorta. Here you go. And then you can drop back down to the parasternal long. Now what Tina just did is she angled the probe over towards the patient's left shoulder, and she's just fanning over. So she's staying in that same position, but she fanned over, and what that did is that brought the tricuspid valve in view with the right atrium below and the RV up top. So you just fan over, and there it is. And then we can place color on that, on the tricuspid valve, to check for TR. There you go. We can put a Doppler through it, hit CW, which is for continuous wave, and check for TR. And TR is going to be below the baseline. He doesn't have any TR, so we're good. And what she did was she froze that image, and then she hit save image. So she'll show you there. So there you go. Color. And Doppler. Hit CW, then hit start, and there you go. And then freeze. And then save. That's it.
2D?
Then we just hit 2D to go back to where we started. She's still at the parasternal long, so what she's doing now, she's going to rotate clockwise about 90 degrees from where she was just at. Still same position on top of the chest. So just rotate. There you go. So now from the right shoulder where you're pointing at, you point to the patient's left shoulder. About 90-degree turn. And look on the screen and you'll see the aortic valve in the center. And then you've got the pulmonic valve to the right of screen. And then to the left you have the tricuspid valve. The septum is right there below the tricuspid valve. It's kind of hard to see, but yeah. There's tricuspid. Yeah. So you can bring your gain up a little bit to brighten the image. There you go.
He has a difficult window over there.
He does.
Yeah. So there you can see it right there. It's kind of coming in. There it is. There's the septum right there below the tricuspid valve.
See that?
Right, there you go. So the aortic valve's in center. We put color. Pulmonic valves to the right. We can check for pulmonic insufficiency. We can do a continuous. We do CW through the pulmonic valve. Check for any. Check the velocity. Check for any PI. So what's going through the valve is below the baseline. Any PI would be above the baseline.
You can change the size by that.
And she's just zooming in on the aortic valve. It's right to the center. There you go. Got color. So what Tina's doing now, she puts color over the aortic valve. You can check for flow. You can check for AI. You can also, she's checking the septum as well. And then left of screens, tricuspid valve, we can look for TR there as well. There you go. TR would be below the baseline. Now all you do is you tail up. You bring the tail of the transducer up, and what that does, you stay in that short axis position, but now you're angling down through the heart, and you'll go first. You want to look at the mitral valve, and you can see the anterior and posterior leaflets. Anterior is top of the screen, posterior is below it. So there's your posterior down below, and that's what's kind of hard to see. Yeah, there you go. And you want to tweak the transducer kind of left, you're kind of like counterclockwise, clockwise twist to make sure that that ventricle is round. You don't really want it very oval. You want to try to get a nice round ventricle so you know you're on axis. There you go. Yeah, that's really good.
Sorry.
There you go. Yeah, so there you go. So anterior, posterior leaflet. You can put color on the screen if you want to check for MR here. There you go. Okay, and back to 2D. And then papillary muscles are below that.
So we're going to angle and probe the
And you
tail
just
of the
tail
probe.
up the probe again, just a little bit more. And there you go. There's your function for the LV. Good way to get a good short axis view of ejection fraction.
And then the apex.
And then we're going to go right to the apical position. Or you can go to apex, you can go even, you can tail up even more and get the tip of the LV, the apex. And then we'll jump to an apical position. Patient stays like that.
Sorry.
Yeah, you're right.
You've moved down from where you were, so you were right here for the peristonal long. For the apical, you're just moving down and you're trying to get right to the apex of the heart. She's rotated her transducer just a little bit more. Now she's almost pointing to the floor with that little marker on the front side of the probe. So she's pointing down, and there you go on the screen. You'll see the 4-chamber view.
Depth.
And you can adjust your depth. There you go. There you go. So there's your 4-chamber view. LV to the right of screen, mitral valve, left atrium, RV, tricuspid valve, and right atrium.
Want to get a fracture? Do you want to do color?
Yeah, we can do color.
What
And the-
point of care
We
for
promised.
chamber is,
Yeah, that's
Okay.
real. Yeah.
And then
Yep. To see the aortic valve, you just tail down from that position. In the 4-chamber, all you do is tail down. Don't move anything else, and you'll see the aortic valve pop up right there.
so from here is your 4.
Yep. Tail
There's your
down.
5.
There comes your aortic valve. Yep. So from 4 to 5, real easy.
All right. And you see the right side of the heart there.
You see the right side of the heart here?
And you can
So
sort of
left.
angle your probe, rotate a little to open up the right
Yeah,
side.
you can kind of adjust it by rotating to bring in the right side a little better. And then from here, since we're doing abbreviated, you would just rotate the probe.
So here's your 4.
Yep, so there's your 4. You
Rotate.
counterclockwise, you're rotating back up in a counterclockwise direction, and you stop when you see the 2-chamber. What you want to see is the mitral valve is flat, and both papillaries are connecting in, and then you know you've got a good 2-chamber view.
You're going to rotate the 3.
Rotate even more counterclockwise, and you'll bring in the aortic valve, and you get to a 3-chamber view. You can see the aortic valve right there where Melinda was pointing. Yep. Mitral valve, LV. There's the left atrium below, yep. That's your 3.
let's move to sub.
So subcostal, you're just going to go, you're going to gel up. Patient's going to usually works best on their back. Patient may already be on their back. So you just go subxiphoid. The probe, the pointer on the probe is going to be pointing right at you as the tech. You go center line, subxiphoid, and it's usually comes in better if you move out to the patient's right a little bit. And that's and you can see here, she's moved out. You see the 4-chamber view just that much better.
Make sure you keep your hand on top of the probe so you're able to flatten out that probe.
Yeah.
Take a big breath in.
So the patient takes in a deep breath, and you can really see the septum between the right and left atrium.
Breathe.
And then when he exhales, it's going to be probably a little harder to see.
You can push.
Yep. And you want to, so that's the
Yeah.
4-chamber view.
Big breath in. Hold it.
So he takes in a breath. There's your septum. Right there.
Done.
Yep.
Right here.
IVC.
Now what Tina's going to do, she's going to rotate counterclockwise. She's going to put that pointer at the patient's face, pointing towards her head, and that's where you'll see the IVC coming in, where it connects into the right atrium.
Right atrium, IVC.
Right there. That's your IVC. So when the patient takes in a breath or does a sniff, we say, give it a sniff test, see how it collapses, and there you go. And you want to record that.
Sniff again. There you go.
This is also a very good view for evaluation of pericardial effusion and
Yes.
potential tamponade.
Good.
Very good.
You should do it.
Thank you, Melinda, Gina,
Absolutely.
Rich, and Keisha.